Hello, everyone. This is Jim Ludwig, and welcome to Main Street Swim with Jim. Today's episode is special because we're going to feature Melinda Caughill from I-65 on the topic of making Medicare decisions. Hi, Melinda.
Hi, Jim. How are you?
Great. And some people may notice that I have a little more facial hair than normal. And that's because this broadcast is coming live or delayed from my studios in Orvieto, Italy, namely the apartment that we're renting.
Yes, and everybody here is jealous.
Well, they can be jealous, but people watching this really want to make good decisions when it comes to Medicare. And I'm going to turn it over to you now to explain how they make those decisions. Go ahead.
Okay, so Main Street Financial Planning has engaged with us to help you make the best Medicare enrollment decisions for your unique needs without any insurance sales involved whatsoever. And I'm going to explain to you, I'm going to take a minute and walk you through the Medicare basics just to give you a sense of why your initial Medicare enrollment decisions are so vitally important. So I'm going to do a screen share. I'm going to push a little button. Here we go. There we go. I'm going to share that. And then I'm going to hit the play button here. So basically, Medicare has 4 parts. We've all heard that before. Well, for the most part, we've heard that. A, B, C, and D. But actually, with Main Street and with I-65 engaging with Main Street, we actually try not to teach it like this. And the reason why is because we've noticed people have a tendency to treat these 4 parts like a shopping list. I have to get an A, a B, a C, and a D. No, quite frankly, you don't. C is actually just a different way to get parts A and B and D. So we prefer to teach Medicare has 3 parts, A, B, D, and 2 paths, 2 unique ways to get those 3 parts. So let's talk about these paths. So basically, when you are making your initial Medicare enrollment decision, you are standing at a fork in the road. Which way do you go? Do you go the path of original Medicare, or do you go the path of Medicare Advantage? So let's talk about original Medicare real quick. This is Medicare that is administered by the U.S. government. The government is essentially in charge when you choose this path. Head down this path and you can essentially see any provider who accepts Medicare. There are no networks. So when you choose this path and you visit the doctor, you're going to pull out your Medicare card. This path always starts with a person enrolling in Part A hospital insurance and Part B medical insurance. Technically, you could stop right here and say, I'm enrolled in Medicare, done. Yes, you could technically do that, but A and B by themselves can become very expensive. Part A essentially has a $1,400 hospitalization deductible. That's not an annual deductible. It's a hospitalization deductible, meaning, yes, you can pay that multiple times in any given year. Part B has a 20% co-insurance on all healthcare services. So every time you see a doctor, a specialist, have an outpatient procedure, 20% of that bill will be your responsibility to pay. And A and B by themselves have no spending limit. You can literally spend and spend and spend until you have nothing left. This is why when you choose the path of original Medicare, for comprehensive coverage, you also add a standalone Medigap policy provided by a private insurance company, as well as a Part D prescription drug plan, also provided by a private insurance company. Essentially, once you've paid that monthly Medigap policy premium, by the way, Medigap and the Medicare supplement policy are the same thing. Medigap, supplement, Medigap, same thing. Once you've paid that monthly Medigap policy premium, essentially most, if not all, of those out-of-pocket costs inherent in Part A and B by itself can poof, go away. All right, so then There is the path of Medicare Advantage. This is Medicare administered by a private insurance company. A corporation is in charge when you choose this path. So we don't put the Capitol building in the background, we put a corporate building. The insurance company is in charge, they get to make the rules. When you choose this path and you see a doctor, you pull out your insurance card. That's how you are identified, not by your Medicare card. Now, these policies have to provide basic Part A and Part B services, but they change the rules that you have to follow in order to get those services. And these plans usually include Part D drug coverage as well. Then, to make this path as attractive as possible, these plans usually have very low or no monthly premiums whatsoever. So whereas you may pay $200 a month for a Medigap policy and $30 a month for a Part D drug plan, on the path of original Medicare, you may pay nothing per month on the path of Medicare Advantage for your plan. That's pretty attractive. And these plans can add elements of vision, hearing, and dental coverage that typically the path of original Medicare does not include. So some nice benefits. Now, this is what is considered Part C. So you take all 7 things, A, B, D, dental, vision, hearing, very low premiums, you throw it into a blender, and this is what you've created. You've created a new type of Medicare known as an MAPD plan, Medicare Advantage with Part D drug coverage. This is essentially what C is, but as you can see, it works more like a path than an actual part. Now, here are the rules that you have to follow when you choose the path of Medicare Advantage. You have to see providers in a network, and that network can change at any time. If you go outside of the network, you may be completely on your own paying for that bill. You are also subject to prior authorization rules. What this means is that your doctor may say you need a surgery, but you will not be able to get that surgery until the insurance company agrees that you need that surgery and is willing to pay for it. Sometimes that's not going to be the case, and you're going to have to figure out a new alternative. Prior authorization rules are particularly come into play for home health care services, physical therapy, and seeing specialists and having surgeries. Now, one other rule, you have to pay deductibles, copays, and coinsurances up to that plan's specific out-of-pocket spending limit. So those are the basic rules you have to follow. Now, here is why I say that that initial path decision is so crucially important. In 47 different states in this country, as soon as you choose your Medicare path and you head in that direction, you basically have to imagine an earthquake happens behind you. Now, if you want to change paths, you have to wait for a bridge. Bridges only show up at certain times of the year. And in order to cross, you have to follow the rules of the bridge. It's actually pretty simple to switch from the path of original Medicare to Medicare Advantage. Medicare Advantage plans have to take you regardless of any pre-existing medical conditions. You just have to do it at the right time of year. However, if you want to switch from a Medicare Advantage plan to the path of original Medicare, chances are you no longer have a guaranteed issue right. That is what it's technically called, a guaranteed issue right, which is the guaranteed ability to get a Medigap policy. Without that guaranteed issue right, the insurance company that provides that type of insurance can put you through underwriting. It can make you pee in a cup, give a blood sample, submit your medical records. If they find anything they do not like, they can deny you this type of coverage, which means, once again, you are subject to all the deductibles, copays inherent in Part A and B by itself with no out-of-pocket spending limit. Essentially, this is why we say people get stuck. Their initial enrollment decisions can get them stuck because essentially, fiscally, there's nothing to switch to any longer. So that's one of the main reasons why why making that initial enrollment decision is so crucial for people turning 65. So Jim, back to you.
Jim is here. So you can stop sharing your screen now, and we'll see you back, Melinda.
Oh, there we go. See, I have to push buttons.
There you go. Anyway, that is a great explanation of the decision people have to make. And it looks like the most critical decision is after they've taken Medicare Advantage. I understand they can switch back in the first year if things don't work out.
Yes, there is something called the Medicare Advantage trial period, but you have to be very careful. The Medicare Advantage trial period is a 12-month period, meaning 12 months. 12 months. If you wait 12 months and 1 day, poof, you're guaranteed to issue right. Your trial period has expired and the underwriting will apply once again. And this, unfortunately, only applies to people who are turning 65 and enroll in a Medicare Advantage plan for the first time. There are some other outlier rules, but for the most part, the best rule of thumb is I turned 65 and the first thing I enrolled in was a Medicare Advantage plan. If those two things do not apply to you, you may not have a trial period. So you can look into it further, get some advice and guidance. But for the most part, that's when you have your Medicare Advantage trial period.
And that's one of those things that we want to help our client do, is make individual, excellent, understandable decisions. You mentioned 47 states. What about those other 3 states? Which ones are they?
Okay, so in the states of New York, Connecticut, and Massachusetts, New York, Connecticut, Massachusetts, all within one little cluster of the northeastern area of the United States. In those 3 states, the earthquake essentially never happens. So in 47 states, you've got the earthquake and you can't switch paths very easily. You have to wait for a bridge. In those 3 states, the earthquake never happens. So you can choose to head down the path of Medicare Advantage at age 65. 2 years later, heaven forbid this isn't the case, but you get diagnosed with cancer. You know you're going to have a fair amount of outpatient procedures. You're going to have hospitalizations. You decide, you know what? I'm going to switch to the path of original Medicare and not worry about out-of-pocket costs. You can do that in those 3 states with no questions asked about your medical health.
And so there's no underwriting for the Medigap policies re-entering for those 3 states.
That is correct. Now, you still have to disenroll from a Medicare Advantage plan at certain times of the year, though. So it's not like you get the cancer diagnosis in May, and May 3rd, you're disenrolled from the Medicare Advantage plan and moved into a supplement. Unfortunately, you're going to have to wait till open enrollment, October 15th through December 7th, to disenroll from the Medicare Advantage plan, and then the new coverage begins January 1st. There are some other disenrollment periods as well, but again, this is the nitty-gritty of Medicare. So that's where Main Street Financial comes in, and that's where they can help with the tool of I-65 and the Medicare experts backing them up at all steps of the game. So,
well, Melinda, it's really been a joy for you to explain with your slides the decisions people have to make. And we're going to use this video over and over again as we educate our clients and help them make important decisions. So Melinda Caughill from I-65, this has been Jim Ludwig of Main Street Swim with Jim. Everybody, pay attention and make good decisions. Bye now.